Stigma is something that all of us are living with as we make decisions about how to navigate this pandemic, but it seems to be a kind of public secret. We're not talking about it on a national stage. We're not talking about it in the halls of power. We think stigma needs to be part of the conversation as we move towards a better world after this pandemic. So we entered into the COVID-19 policy conversation right in the middle of the first wave. Our PI, Professor Laura Baer, was invited to be on the SAGE SPI-B committee, which is the group of behavioural and social scientists who are contributing to government policy making during the pandemic. So Professor Laura Baer was given a brief to try and understand what a good death might look like in these difficult circumstances, where people are unable to follow their usual rituals and rites of burial, funerals and bereavement. We had a particular set of tools that the rest of the government research facility didn't have, where they usually run focus groups or surveys. We were able to interview key figures across ethnic minority communities, faith communities, and other vulnerable groups in order to understand what this moment was like for them, particularly those communities who were experiencing excess death or disproportionate death, for example, ethnic minority communities. What we were able to gather was that this was a moment of collective trauma across communities. Everybody was experiencing this sense of untimely death. The fact that people were dying before their time and they weren't able to be buried or given a respectful and dignified funeral. And we were able to give some really important recommendations about how to ease this sense of trauma. These included things like memorialization, having a right to say goodbye in hospitals, and the prevention of mass cremation, which could have been extremely traumatic for some communities. We were able to write a very rapid report that fed into government policy making circles and was able to change the response right in that first week around Easter when the mortality rates were the highest. So what we picked up on in that moment was that sense of untimely death was really disturbing for many communities. People felt really anxious, they felt really fearful. And that was compounded with other forms of uncertainty that were affecting all of our lives. The relationships that make up our lives, the very substance of the way we live and care for each other and show up for each other, were truncated. We were unable to connect to people who we care for elderly, for younger people, for those who are disabled. We were also stuck at home with certain others where the relationships were extremely pressurized. This produced a perfect storm of uncertainty. Government policymakers were also experiencing uncertainty. They didn't have a full picture of what was going on. And so we decided we could deploy our anthropological expertise and our ethnographic methods to try and pick up on how people were experiencing this moment of uncertainty. We were able to look at the inequalities between different people's experiences, and that kind of scaled up to a broader picture of how the pandemic was playing out across the UK. We did this by particularly doing two kinds of methodological things. The first was to try and illuminate slices of life. So our team have existing links to different parts or communities in the UK. And they were able to activate these links to shed light on, for instance, what it was like to be homeless in Cambridge, what it was like to be a small business owner in Ely, what it was like to be someone working in a local authority in the Northeast or a mother in London. And we put these slices of life together into bigger case studies where we were able to contrast different people's experiences of the pandemic. From this, we realized that some were being disproportionately impacted by transmission and mortality, but also by financial loss and other forms of social distress. So for decades, anthropologists have been studying the relationship between illness and uncertainty. And what many have found is that in situations of uncertainty, people seek to build boundaries. This means that they try to separate out those who are risk givers, people who can make them sick or risk epidemiological transmission, and those who are risk takers, or those who are particularly vulnerable to experiencing adverse impacts of that particular risk. So dividing the world into risk givers and risk takers is not always based on evidence. People do this speculatively. And speculation means that you're trying to project some kind of order onto a radically uncertain future, as Professor Laura Baer talks about in a lot of her other work. We see that this act of splitting the world into risk givers and risk takers works to polarize, exclude, and sometimes even stigmatise certain groups because they're associated with increased risks of epidemiological transmission, not based necessarily on evidence, but sometimes based on rumour or stereotypes. So that work of managing who was a risk giver or who was a risk taker was something that we were all doing, and we all still are doing in this moment of the pandemic. The work of managing risk is part of every decision we make about who we allow into our homes, where we go to do our grocery shopping, where we go to eat, where we go to meet our basic needs. We also realised through our work that this kind of management of risk fell unequally to some people in the household more than others. Particularly women had to do the work of managing risks for their children and elderly relatives. This became part of the work of care. We realised that this was a really interesting moment for understanding what it meant to care for people, because it meant both cleaning, making the house or place of work hygienic, but it also meant managing which relationships were deemed safe or unsafe in order to prevent the risk of epidemiological transmission. So through our research across the UK, we realised that there were some groups who were experiencing stigma more than others. The first group we realised who were experiencing stigma were essential workers, particularly from the beginning days of the pandemic, where people were really scared of those who were unable to lock down. We realised that some of these people were being excluded from social bubbles or asked to leave their residence because of fear that they would bring the virus home. We also realised that young people were being stigmatised.
Dozens of young people doing what dozens of young people do, partying and enjoying the summer.
They were being blamed for meeting up outside the home or bringing the virus home from school at some times, which wasn't always necessarily the case, as often they had to shoulder caring responsibilities where their parents or grandparents were unable to leave the house because of shielding. We also realised that minoritised groups were being stigmatised. This was particularly an output of the Public Health England report that noted that certain minoritised groups were experiencing higher levels of mortality. This was also experienced by these minoritised groups as a heightened sense of vulnerability, where people were really scared about what this new information meant. Another group that we saw who experienced stigma were those who lived in cramped accommodation, or accommodation that was not necessarily spaced out, so people suspected that people couldn't social distance. We saw the stigmatisation of multi-generational households as a critical thing that actually worked to deepen divides of racial or ethnic minority stigma. It's essential that we address relations of stigma that have emerged during this time of uncertainty so that they don't continue beyond this crisis. We can do that by building solidarity between communities, not just through communications that use good language, but also by supporting communities who feel marginalised in this time. The Community Champions Initiative is essential to this, for instance. So is ensuring that financial support and, I suppose, as in the government's terms, levelling up of different places occurs over the course of 2021. We also think it's essential that we ramp up the amount of ethnographic and qualitative research we have available to us on how these social divides are playing out and interacting with other forms of social change that we're experiencing, like Brexit. Further, we think it's really essential that we increase the funding and support for people who've experienced mental distress as a result of this pandemic and as a result of the new relations of stigma that have emerged from them. This could be through local care centres, increased community level mental health funding, and funding local community groups to provide culturally appropriate care for people who need it. We think stigma needs to be part of the conversation as we move towards a better world after this pandemic.